You've had fat grafted into your face and you're not happy. The reason why is that you wish that some of the fat would go away. So I'm going to tell you 6 different ways that we can actually make that happen. So before we even get started, it's important to know that you have to give it time. What I have discussed in other videos is that when you have any procedure, you're going to have a little swelling. Well, with fat grafting, you're going to have some swelling from just having this procedure as well as from the fat. The fat actually gets a little swollen. The next thing to realize is that with fat grafting, you actually have to inject or transplant or graft a little extra. So by that I mean, we know as plastic surgeons that some of the fat actually gets absorbed. So that means as a plastic surgeon, I have to overgraft it a little. So the next day after surgery, you're going to be swollen from surgery, and you're going to be swollen from swollen fat cells. And finally, you're going to be swollen because I have to have given you a little extra fat to account for absorption. So you have to give it a little time before considering any of these procedures. Now, having said that, the first way is actually manual, in other words, massage. If you actually physically crush the fat cells, massage the fat cells, try to spread them apart, you're actually making them go away. So you're actually destroying them, if you will. That is one way to actually get rid of fat in areas where you had fat grafting. The next way is with cortisone injection or steroid injection. So what I have to do as a plastic surgeon is, of course, I have to inject it with steroid carefully in the office and monitor how much steroid you're getting. You may need repeat injections, for example, once a month, once every 6 weeks, something like that, to really get the result that you want long term, but that is definitely an option. Another option is actually an injectable. It's called Kybella or deoxycholic acid. So what this medication is, it's FDA approved for submental fat, in other words, your double chin. For off-label use, I can use it to actually melt fat. That really depends on where the fat's injected in your face, how close it is to certain vital structures such as your nerves and other things. So it is an option, and that works quite well. Now just be aware that injecting Kybella or deoxycholic acid will cause a little more swelling. So next up, of course, is actually liposuction. So liposuction means that I have to numb up the area, give you a little vasoconstricting agent, and then I need to break up the fat and suck it out. So this works really great around the neck and under the chin area. It doesn't work very well on the face itself. The reason why is that there are a lot of vital structures and nerve branches in the face. It is an option. It really depends on the circumstance. Next up is actual RF Microneedling. So microneedling is simply a technology where we're poking tiny holes or channels in your face. RF is radio frequency. It's an energy type, and it's not light, it's radio frequency. It delivers heat into the needles that have just caused that tunnel. Deeper placement of the needles, as well as sort of a higher level of energy, that is going to actually melt fat. That's pretty superficial in a lot of patients. So this works quite well in the neck and face area, depending on how deep the fat was actually placed. If your fat, which was grafted, is actually, for example, on a bone, doesn't really work that well. But yes, RF microneedling is an option. A next option and final option is really surgical excision. So in other words, nobody loves to hear about revision surgery or me actually going in there, physically removing the fat, cutting it out and removing it. But that is an option for you if you've had fat grafting and a little too much remains long term. One option that patients ask me about, which is not a great option at all, is actually called cryolipolysis. The brand name is called Cool Sculpting. Cool Sculpting does work to actually freeze the fat, if you will. It really can't be placed easily on the face, which is why it's not a great option. The other thing with cryolipolysis is that it cannot be modulated or controlled easily at all. In other words, leaving it on for longer, cranking up the power if you can, doesn't really work that great if you have fat grafting, a little excess, and you're not happy with the result. I hope you're not unhappy with your results. I hope you're happy with your results. Having said that, if you are unhappy with your fat grafting, don't be too grumpy. There are viable non-surgical options or less invasive options which will help with the overall results. So if you have any other questions or have any topics that you want me to discuss, please fire away in the comments. And of course, you can always watch this other video where we can learn more about plastic surgery.